Got it.
No relation to Phil.
Hey, everybody, this is Eric Mischie, SAVE Executive Director, Suicide Awareness, Voices of Education. We are continuing our Help Heal Hope live stream conversations this week during Suicide Prevention Awareness Week as a part of Suicide Prevention Awareness Month. We've had a lot of amazing, insightful conversations over the last several days, ranging from veteran issues all the way to social media, conversations about phones and whether phones should be in the classrooms and what impact that has on mental health and all these kind of things. And the goal of these conversations is to really kind of open up a line of dialogue with folks that are some way, shape, or form involved in suicide prevention. They may be experts in the field. We've got some folks that we've been talking today who are suicide loss survivors, who will share with us kind of how they've turned their grief into hope by helping others. And so kind of a wide spectrum of conversations on folks that are working on a local, state, and national level. And so we're going to continue that conversation here today with Verna Mikkelson, who is with the Minnesota Department of Health Suicide Prevention Unit. Hello, Verna. How are you today?
Bonjour. Good morning. Good afternoon, Eric. Doing well.
Good to have you here. Been having a lot of great conversations. I know this is going to be a good one as well as we kind of talk about 988 and the work that you're doing here in Minnesota, which, obviously, states in their role and engagement with 988 is critically important to the success of 988 across the country. So maybe we'll start off kind of maybe give us a little background on you and then talk a little bit about the work that you're doing with the 988 Lifeline.
Miigwech. Thank you, Eric. Bujuanin, Verna Mikkelson, Indigenous Cause, Gawaba, Biganakag, Dunjaba. Welcome. Hello, I'm Verna Mikkelson, a member of the White Earth Band of Ojibwe, located in northwestern Minnesota. I am the daughter of an 85-year-old boarding school survivor, the mother of a United States Marine Corps veteran, the mother of a young adult daughter with lived experience, and mother to a rambunctious 9-year-old son and 2-year-old mini Aussie Husky, who we may likely hear make her presence known in our time together today. With this background, and as a suicide loss survivor, I've lived the combination of that intergenerational trauma combined into a world of resiliency, which enhances my work to support suicide and substance misuse prevention areas across tribal and civilian communities. My professional background in suicide prevention, intervention, and postvention over the last 14 years focuses on incorporating that culturally relevant and safe education, training, and services at community and administrative levels. And this includes having worked with my tribe's mobile crisis team, as well as providing training and technical assistance at SAMHSA's Tribal Training and Technical Assistance Center across Indian country with urban Indian organizations as well on suicide and substance misuse prevention efforts. Also in that role, I led the 988 tasks to better enhance access and relatability of 988 across our tribal communities. This was during the first 2 years of the Lifeline's 3-digit update. And today, as Eric stated, I join you from MDH. I join you as the 988 Tribal Suicide Prevention Coordinator with Minnesota Department of Health Suicide Prevention Unit within the Injury and Violence Prevention section. In this position, I continue to work toward building partnerships and collaborations across 988 systems, including those with the Minnesota 988 Lifeline centers, mobile crisis teams, and tribal and urban Indian programs in effort to further connect and enhance existing resources and services for our community members. In our prevention work, we strive to strengthen community prevention efforts, again, through enhancing those existing resources and expanding partnerships across tribal communities with leaderships and external partnerships. Along with that, I'm a trained facilitator in CALM, that is Counseling on Access to Lethal Means, GONA, Gathering of Native Americans, postvention, and Safe Talk, which is suicide alertness for everyone, and bring that emphasis on suicide loss bereavement, safe messaging, and cultural relevance and safety. In my work, I provide some of these workshops alongside our fabulous team at the MDH Suicide Prevention Unit, as well as with partners across the state. So with that, Eric, I look forward to further discussing the 988 efforts with you.
So a lot of stuff there to unpack, a lot of work that you're undergoing. So for folks that are watching, so share with them, you mentioned SAMHSA, maybe share with folks what SAMHSA is so that they understand what those the acronym means and how does that kind of interface with the work that you're doing.
Great question, Eric. So SAMHSA is our federal partner at that federal level, the grant administrator, so a funding source, the Substance Abuse and Mental Health Services Administration, who funds 988 and many of our programming in suicide and substance misuse prevention, and works closely, as I mentioned, the Tribal TTA Center, the state partnerships, the Lifeline centers, just all across communities in the prevention efforts and funding those sources, and hearing the community's input from the people doing the work. And so SAMHSA is doing a nice job to really hone in on the needs at that community perspective level and gaining insight from our experts in the field who include suicide loss survivors and those who struggle with mental health.
Okay, thank you for that. So 988, kind of has kind of overtaken, if you will, this space where we now have gone from what used to be a very long 1-800 number, and then there was a shorter 6 or 7 digit number, and we've now gotten to a place where we mirror the ease of a 3-digit number that we use when we're dealing with an immediate kind of emergency medical situation. And so 988 in a relatively short period of time has become pretty ubiquitous. As we talk about that, for organizations like ours and you, that, this is a place where if you are in crises or you just need somebody to talk to, that you're able to call or text 988 and get access to people who are not only trained, but can also, your information is confidential. It's 24/7, 365. So let's talk a little bit, share with folks, when you talk about the work that you're doing in 988, kind of elaborate a little bit more on what does that look like?
Yes, and thank you for that overview. As you stated, so first I want to say I acknowledge and see, scrolling on the screen, it looks like we have that prompt if someone is in need. And we love to start our workshops, our conversations and discussions with that emphasis of support, because we know bringing awareness around suicide, mental health, and connecting to people to support makes such a great difference. And we want people to know that support is available through 988 if they need someone to talk with. And understand and respect it. The topic of suicide is very personal, can bring up many areas of reflection and emotion for those listening, and to please take care of yourself as needed and reach out for support. So Miigwech, thank you for having that scrolling. And we greatly also want to acknowledge SAVE for the activities this week in the conversations around safety, safe conversations around mental health supports and suicide prevention, as well as highlighting us today with 988. So a little background, as Eric shared, the new 3-digit number 988 was introduced July 16th of 2022. And as Eric shared, that lengthy 11-digit 1-800 number was maybe not so easy to remember. And moving forward, the 988 number just really sticks when a person needs it, and easy to remember, especially easy to dial when in need of that mental health emergent support. And so 988, again, available to anyone at any time. And we can also use 988 on behalf of someone else. It's a great resource to help us provide supports. So the call, text, and chat versions are accessible 24/7, 365, and the chat can be reached via the website at 988lifeline.org. And ASL video phone is also available at the website. There are a few specific options available to help personalize interactions. These include bypassing the greeting. Press 0 if you're not wanting to wait on that greeting. Press 1 for the Veteran Crisis Line. Press 2 for the Spanish Language Network. And press 3 for the Two-Spirit LGBTQIA+ network. And so getting that unique experience with someone that can, again, relate. And considering 988 specifically in Minnesota, I will share regarding our 5 988 Lifeline calls, our 988 Lifeline centers. I have to remember technology. We have such integrated technology nowadays. It's not just a call center, it's text and chat as well. So our Lifeline centers are designated to answer those calls, chats, texts all across the state. And our Lifeline centers include First Call, based out of Grand Rapids, Minnesota, Carver County Mental Health Crisis Program, Greater Twin Cities United Way, based out of Minneapolis, Mental Health Minnesota, based out of St. Paul, and First Link, based out of Fargo, North Dakota, covering the northwestern part of Minnesota and tribal nation there. And so uniqueness with each of those, what they bring in, what they offer, and availability 24/7, no matter the time of day. So prior to the transition to 988, those Lifeline centers worked diligently in the months prior up to the transition to ensure that Minnesota was prepared for an increase in volume, including onboarding new crisis specialists. In April of 23, Minnesota launched the 24/7 chat and text support. And so integrating that made a difference in the ability to answer contacts in state. In June of 24, there was significant increase in help seekers reaching out via text across the country as a whole. And text from Minnesota to 988 more than doubled in June of 24 compared to January in 24. There were 2,449 texts in June of 24. There was a 43% increase in contacts from Minnesota to 988 in the 2023 compared to the year prior. And 73,738 contacts, including those calls, texts, and chats, were made in 2023. And that includes those Minnesotans who were selecting those unique options with the subnetworks of veteran Spanish speaking and Two-Spirit LGBTQI+. And so all of this data in the data form and the numbers, not my favorite thing to focus on. It shows the reflection of the work happening and that increase in volume and exactly how the Minnesota 988 centers have been able to keep pace with the volume. And so it's important for folks to reach the local centers when reaching out to have those better supports of understanding what's available locally, the resources and services available in the state. The Lifeline centers in the state are more familiar with those various cultural groups in the state as well, and have connections and partnerships with local mental health organizations. And again, those crisis services, collaborating together with mobile crisis as needed, with 911 as needed. And so those 988 centers are committed to saving lives and supporting individuals who reach out. All across 988 centers across the country, everyone is certified and held to the same standards as far as training and learning how to respond appropriately. provide those supports, referrals, resources. And as you can imagine, with this transition, it just seems much more readily accessible with that 3-digit number. And so as you can imagine, naturally, there were some challenges experienced.
So let me jump in, because one of the things that I think would be helpful for folks who may not have used 988, right? Who are being in a positive way, being bombarded with, hey, if you're in crises, call or text or chat 988. Talk a little bit about what one can expect when they interact with 988, right? Most people think of 911. We've seen it on TV where you call 911, there's an operator on the other end who immediately asks you, what's your emergency, what's your address, and these kind of things. Or actually, I think they ask what's your address first, whatever the case may be. But what does that engagement look like if someone engages with 988?
Yes, excellent question, Eric. Let's take a look at what happens during a 988 contact. And so first off, everyone is screened for suicide risk. From there, each interaction is based on that conversation, that dialogue that ensues between the 988 call, the specialist, and the person who reached out. So the crisis specialist is going to ask specifically, are you thinking of suicide? And secondly, have you taken action to harm yourself in the last 24 hours? From there, when the response is yes to either question, the specialist will work with that individual to assess their safety and work to create a safety plan with the individual. When the answer is no, they will also continue to be supported. The call specialist will share resources and help the individual find local supports. So the role of the 988 crisis specialist is to create a safe, non-judgmental space for individuals to express their feelings, their thoughts and concerns, and they're there to listen and support each individual. When appropriate, that 988 specialist will then work with the person to develop a safety plan that can help identify their coping strategies, individuals, people in their life that they can reach out to for further support as needed, and help provide information to local resources. That safety planning is an actively engaging opportunity with the individual on the line, on the chat, on the text, connecting with the lifeline to help them create their own safety plan and assessing risk factors, barriers, safety nets. It includes assessing for the desire to act on those thoughts of suicide, their intent, and their access to carry out a plan. The goal of that safety plan, of course, is to empower the individual to achieve their own safety plan, removing those risk factors, understanding potential activating factors, and identifying supports and creating a plan to de-escalate and achieve safety. And I will share some links in the follow-up here, but utilizing the mini Stanley and Brown safety plan, which is available on SAMHSA's website, and we'll drop that link in the chat following the live. It's a nice, super handy dandy little tool, and it walks through those areas to help the individual go forward and maintain safety. Emergency service involvement is typically consent-based unless the life of the individual, of course, is in immediate danger. And I'll share a link in the chat as well about what to expect with the variations of contacting the lifeline.
So I just threw up the link on the Stanley Brown safety plan that's on the FPRC website. So we threw that on there. Awesome. So folks can go to the Suicide Prevention Resource Center. That information is on there. That's something that is useful and helpful. So as we talk about that interaction engagement, one of the things you mentioned is putting together a safety plan. So how does the mobile crises piece of this connection with 988 interface with that?
Definitely sharing that as a resource. 988 can potentially connect with. There's a lot of work in progress in collaborative efforts of how the 988 Lifeline centers can connect with mobile crisis response, since our Lifeline is not in person, and those mobile units are available in person. And so typically the contacts with the Lifeline are able to be de-escalated to where the next step is maybe a follow-up in a day or two by the method of original contact, whether that was phone, text, or chat, following up with the individual directly from the Lifeline. And if further support is desired with the individual help seeker, connecting them with those local resources, and mobile crisis would be an excellent resource.
Okay. And so one of the concerns that I know that was often expressed early on in the genesis of 988 was the issue of confidentiality. And how do you make sure that people who may be in a crisis can feel comfortable that they can talk to somebody, and that information is not only going to remain confidential, but that information about their physical location or things like that isn't automatically somehow or another transmitted to law enforcement or things like that. How have you worked to kind of calm those concerns and address those issues and fears that people might have around 988?
The Lifeline centers do ask for demographic information. They do preface their statements that this is confidential. You are free to share or not share specifics. Information utilized does not leave here, that type of conversation. Just really establishing a relationship at the front, letting the help seeker know the capabilities. Here's what I am able to help with today, and here's where I'm not going to take your information. And so once that rapport and communication is established, help seekers typically are open to sharing more information and may do so upon conclusion of that interaction by staying on to potentially fill out more information as they so feel fit. And so it can follow the conversation. And as far as numbers and that type of thing, not tracked, letting them know that this is a safe space.
So let's kind of go back to the conversation, the kind of what you were kind of laying out for us in terms of your work specifically, and kind of how does that interact with different populations, tribal communities and others, and what makes things unique in that space?
Yes, great question. And ways that we're working on that, several ways. One of that is connecting our Lifeline centers with tribal partners. All of our counties are covered through mobile crisis, and many of our tribal nations provide mobile crisis response. And connecting those two together to support resources, what's available, be familiar with those resources. Also bringing in cultural safety training and education to staff, helping share out here's what works well in Indian country. Here's what exists already that we don't need to try to duplicate. Here's how to ask some of those demographic questions where we may not be comfortable knowing. And so having an open space for discussion on how to build, again, relationship building with tribal partners and what that can look like. There also is a need. We learned early on with 988, that transition in work with SAMHSA and across the states and partnerships and tribally, we learned feedback that there is a desire for connectedness. We want to connect with someone who can relate and or is familiar with our area. And so having some of those promotional materials that reflect our tribal communities, having some of those that reflect other populations that may not feel seen and heard. And so getting specific. And one of the ways we're doing that too through MDH is seeking community awareness campaigns, having, our funding can support that. And so having RFPs put out, requests for proposals on who can fulfill to meet the needs. And that is an area 988 as a whole, Eric, oftentimes I'm surprised when I am in community and sharing about it. Oftentimes people are very honest. I've never heard of 988. What is it? And so it's a great opportunity to enhance awareness around 988 as a whole. And so working on communications campaigns and some specific to demographics as well.
Yeah, and I think, part of this always, when especially, again, while 988 may feel as though it's been around for a long time, in reality, it's not been around for that long of a time. And it takes time to get people familiar with it. And again, you're building a big national network, right? This isn't just 988 in this state or that state. It really is to try to be interconnected throughout the entire country. And then again, remembering that within the country, there are other populations and nations that occupy within the country that you've also got to recognize that there are some unique needs that need to be addressed there as well.
Yes, most definitely. And those community awareness campaigns, community level trainings and education, we're happy to support. MDH has several suicide prevention partners across communities through various grants. And some of those efforts on our part with our internal staff that we're able to help reach include efforts in fulfilling requests for suicide prevention, TA, technical assistance, training and education in communities. And so we appreciate interest in those efforts. Our injury and violence section uses the public health approach, of course, to prevent suicides and support coordinating those state-funded prevention activities and planning that TA again and support any type of those requests, which can come in through our website. I'll plop that in the chat as well. But yes, there's a form there. And if so desired, you can reach out to me directly, verna.mikkelson@state.mn.us. And just a brief mention, I wanted to highlight and just give a shout out, a kudos to all the work happening. You asked what does that look like when people call, and there are so many call specialists that Lifeline specialists, crisis specialists that are helping support behind the scenes, and recent reflection of their hard work and response for our August of 24. Those calls are being answered at 91%. Chats are being responded at 90% and texts at 92%. So that number, that response number is increasing significantly and readily along with the newness of 988 and the lengthy back history there of that 11-digit number. So it's exciting and hopeful to see those answer rates across the board, and just want to recognize and celebrate that great work for the Minnesota 988 Lifeline Centers having achieved those high answer rates, their team's dedication and support just to ensure those help seekers receive timely support is making such a difference in communities every day.
Yeah. Well, as I promised at the beginning, the half hour is going to go fast and it's coming to an end here. So one of the things that we've tried to do in each of these conversations, Verna, as we kind of wrap up is, what all of us are doing in this space is trying to bring hope to people. And that's kind of our job. That's our mission. That's our end goal, is provide hope. So I want to give you an opportunity to kind of share that message of hope from the work that you're doing to folks, that to know that the work that you're doing there is providing hope to people. And how would, as you kind of close it out and share with people the work and why you do it the way you do it, what kind of message of hope do you want to share with people?
Yes, oh my gosh, for that. So, we hear a lot about resiliency, and it can take some people back a step. How resilient do we need to be? How much more resilient can we be? And so I like to look at that as hope and reconciliation of where we've been, where we've traveled, where a journey has led us, and where we're going next. And so with conversations like this, just really creating those safe opportunities to have these conversations and know help is accessible. Hope is there tomorrow, and it just takes one more step to reach out and connect.
That is good, hopeful words to end by. I want to thank you for the important work that you and your colleagues are doing, and the privilege that we have to partner and collaborate with you all in this space, and continue to do that important work. I know that we'll continue to talk and work together and find ways to make sure that we're able to help and heal and hope folks and in everything that we try to do together.
Miigwech for that, Eric. A big miigwech. Thank you, and for letting us share out today through Save Suicide Prevention Week and social media gatherings. Excellent opportunity.
Have a great day.
Take care.
Thanks.